Welcome to Totally Woman Podcast. Totally Woman is a bi-weekly podcast that uncovers essential health knowledge and highlights inspiring journeys that transforms women's lives. I'm your host, Rosemarie Crosdale, a licensed adult gerontology nurse practitioner, and this season we want to hear from you. Find us on Instagram at Totally Woman Pod to join our conversation. While we encourage you to listen to this podcast for health tips, it is not a substitute for a relationship with a primary care provider or clinic. Now let's get to today's episode. Hello, everyone, and welcome back. Welcome back to Totally Woman, the podcast. This is your host, Rosemarie Crosdale. I cannot tell you how grateful and how thankful I am for your continued support. And I just want to express my gratitude for those who still continue to follow me, still continue to engage and listen to the episodes. You are just amazing. And I just really want to thank you. This podcast is a podcast that's dedicated towards women, my love for women in terms of how our bodies, our makeup, and just how sophisticated we are. I'm not saying that the men aren't, but we're talking about us now. So it's all about us. This podcast is designed to just educate. It's designed to celebrate you, your ups, to celebrate your downs, wherever you are in your life, just to give you those reassurances and let you know that Rosemarie Crosdale from Totally Woman totally supports you. And this is what we're all about here. So welcome. If this is your first time joining, I want to welcome you. And I want to just tell you to also tell someone else about this podcast. You can go back and listen. We are actually in our third season. We have Yes, we're 3 seasons in, and this is going to be our sixth episode of this season. So if you want, you can also go back and binge listen to our previous 2 seasons. And I'm pretty sure that you will end up getting something from those seasons as well. So welcome to everyone. And thank you so much again for joining me. I do not take any of this for granted. But ladies, it is October. And breast cancer is very near and dear to me. I have friends, I have family, so many women who have breast cancer. And, I just want to say to the women who are enduring and who are going through, I want to honor those women who have passed on and who have just fight this battle with strength and resilience. I just want to say a thumbs up to all of them. I'm just here to continue to supporting you because this is not an easy road to travel. This is not easy at all. And I just want to continue to just honor the survivors and to remember those that we have lost, remind ourselves and each one just to continue, ladies, to take charge of our health. And like I always say, if you go back and you even listen to those previous episodes, early detection is what saves lives. Early detection, early screening. And one of the simplest ways that we can do as women is to do our self breast exam, right? Doing our self breast exam is something that we learn even in our teenage years, just to start, looking at our bodies, looking at our breasts and touching on our breasts, right? We say, getting to know our girls, right? Referring to our breast as our girls, because this is how we get to know when something is going on within us. And how do we know? We will know because we will know what is normal for us. So when something is not normal, then you will know it. But in order for you to know this, you have to be checking. And self breast exam is a way for you to do that once a month, right? Once a month, especially after your shower, You stand in front of the mirror, look in the mirror, make sure that you could put one hand on your hip, and make sure that your breast is fully exposed. Raise your arm over your head. Notice your breast. Look at the color, right? Look at the skin. If it's evenly distributed, the skin, the color. Notice if the texture, notice the texture of your breast either. So in order for you to know the texture, ladies, you have to be touching on your breast. So you can't be afraid to touch, right? You have to touch on your breast. So raise your arms and touch on your breast, and use the pads of your three fingers, especially the three middle fingers, right? Going in a circular motion, and go around the entire parameter of your breast, and just press in hard enough, not super hard, but hard enough where you can feel, right? You can feel if there are any bumps, you can feel if there are any lumps, and you do this around the entire parameter of your breast. You're also wanted to also look at your nipples, look at the areola, which is the darkened area where your nipples are. Observe this, look at the texture, look at the color, see if there's any discharge, squeeze your nipples if there's any discharge also coming from your nipples as well. All right. You're using light to medium pressure to feel. You can also lay down, because sometimes, especially if you're a bigger person and you're standing up, maybe it's a little bit uncomfortable. So you can lay down, and you can go in and you can do the same circular motions as well. The best time to check your breasts or to do your self breast exam is a few days after your menstrual cycle ends. So, a few days after your menstrual cycle, once a month, you can go ahead and do your breast self exam. If you no longer have a period, especially for those of us in menopause like myself, you can just choose one day out of the month that you decide that this is when you're going to do your self breast exam. Also, for those ladies who are in perimenopause. So, if you're in perimenopause, it means that you're still having a cycle, but that cycle sometimes can be an irregular cycle. So, just like my women in menopause, you would probably still also choose just one day out of the month at a specific time. So, say, for example, you're going to say on the 12th of every month, I'm going to do my self breast exam. Then you make a note of that. You put an alarm on your phone so that, or a reminder on your phone that every 12th of the month, you're going to be doing your self breast exam. And that is a very, very important a part of screening, is doing the self breast exam. Now, let's talk about mammograms. And in terms of mammograms, I've already talked about that in previous episodes. The recommendation for getting your first mammogram is usually around the age of 40. But ladies, understand that there may be some different kind of circumstance, right? Some extenuating circumstances, or based on your situation, that would preclude you to get your mammograms done much earlier than if you were 40. And you say, Rosemary, what are some of those situations? So, if you have a maternal mom, or a maternal grandmother, or a maternal aunt who has had breast cancer that you know of, right? Because sometimes, a lot of times, if people have passed on, we don't know our history, so if you don't know and stuff like that. And sometimes women, for some reason, younger than, in their 30s, we see sometimes they end up developing breast cancer, right? And some of them may have the BRCA gene, and some of them, may not. It could be idiopathic as well, meaning that we do not know where it came from. And these are things that can also happen as well, right? So, there could be a situation where you could be required to get your mammogram earlier than 40. And that would be just like I just said, if you have someone, on your maternal side who has previously had breast cancer that you know of, then you would want to get your mammograms done much earlier. And that's something that you can always talk to either your primary doctor or your GYN about. And then they can schedule you so that you can be screened to get a mammogram. And ladies, I understand. The mammogram is not the most, we know already, having your breasts between two plates that just push them down together and squeeze them, it is not the most comfortable thing, right? But in order for us to be screened and just to get over, to know if, what are the odds, like, what are the odds of you having some changes in your breast, this is what is going to tell us. And there's some women sometimes, based on the density of your breast and some things like that, instead of just doing just a mammogram alone, they may also require you to do an ultrasound of your breast, right? A lot of times that happen as well. So sometimes even I find myself that I have to do that also. And some women are like, well, why don't they just do the ultrasound and forget about doing the mammogram? But they have to have some information before in order to work with, to see what they're actually working with. And then they'll also do the ultrasound as well. So remember, ladies, it's not just when you're 40. Yes, 40 is the recommended age, but there can be situations where you may have to get your mammograms done much earlier. The goal here is to get you screened as early as possible because, believe it or not, early detection really does save your life, right? When we know, then we know how to go about getting treatment. What kind of treatment are you going to need? Sometimes it's something that is not very invasive. Sometimes it could be, depending on what it is, depending on what they find, right? Because sometimes we've built up all of these things and the things that we hear and, from other people and stuff like that. And I understand we're all humans, right? And everything you're going to look at it and you're going to say, oh my God, and the doom and gloom, and you put it right on away. But you cannot doom and gloom yourself when you don't know what your situation is, because it's something that can be also treated. But the earlier we find it, then it's the easier that it is. And sometimes, yes, you may say no, it may not be easier, which is true, because sometimes everybody's situation is different. But at least then we know now, and you know what you're dealing with and how to deal with it. There's so many resources out there also that are available for women with issues with breast cancer. For years, we have heard of Susan J. Komen, all these resources that are still available for women, with breast cancer. There are a lot of resources out there that are available as well in your community. The best thing to do is to make sure that whatever situation you find yourself in, that you get paired up with someone who is well versatile in that area. Do reviews on these, whether you have to come in contact with a surgeon, an oncologist, or whoever you have to deal with. Please make sure that you're getting adequate referrals. Make sure that you're checking reviews. You're not just choosing someone randomly. This is someone who is going to be taking care of you. And technology has come so far. There's ways now where they can actually preserve your breast. Many years ago, it would be a thing where you would just have to have a mastectomy, and that was like the only recourse that women has had. But now we're seeing where, with technology and with so many other different types of procedures, there are different ways now that treatment can be carried out. But in order to know what treatment, is best designed for you, then you have to be screened. And these are some of the ways, ladies, that we can screen you. I understand it's not the most pleasant thing. And when it comes to a lot of stuff that we have to use, especially to diagnose certain things for us, it's not very pleasant, right? But we just have to go through this. And I understand that it can be very, very stressful as well. Ladies, no man is an island, no woman is an island, right? These are things that sometimes it's going to be new for you. Right? There, like I said before, there are resources that are available. If you need to talk to someone, I know sometimes just in the beginning, probably just getting that diagnosis alone, it's like, oh my God, it's so overwhelming. Where did this come from? Why did I get it? What did I do wrong? Some women blame themselves. It's so many different emotions that you could be going through. And sometimes you may need to talk to someone, right? So even just getting this diagnosis, diagnosis and the added stress and everything of just dealing with everything can be so, so much. But understand that there are resources, there are people that you can talk to, there are therapists. Ladies, I'm going to encourage you, please, 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 if you need help, ask for help. Ask for help. Do not try to do everything by yourself. There are certain things that you just have to ask for help for. And in certain situations, that's what you may need. And having a therapist is not the worst thing. Having a therapist can be good because here is someone who is very neutral. They know nothing about your situation. Some of you may even with just talking to your family about it, because a lot of times when we get these information, or you get the news, or you get your diagnosis, sometimes you could be by yourself, right? And you're by yourself, and now it's like, how do I tell my children? How do I tell my family? All of these emotions, these are things that are going to be going through your mind. Your mind is just going to be going, and it's just going to be racing. But there are resources and there are people who are available who can help you. And I want to encourage you to definitely please utilize all of these resources that are provided that can guide you along through this process. Having breast cancer is not a death sentence. And I understand, yes, some people do succumb to the disease. Yes, we do understand that. But at the same time, there's so many women and survivors that we have out there right now who are doing so, so well. So we want you to be one of those survivors. And I also want to point out, even just to give, this, I remember one of my very, very good friends, she ended up with breast cancer. She was a guest on season 1. She was on episode 6, and she shared her story with us. Ladies, this is a very uplifting story. If you guys want to go back and listen, her name is Nicolene Miller, and she shared her story and her journey with breast cancer. And I want to say that even as we speak, she right now is doing so much better. She's actually doing well. So just as an update, she's one of our breast cancer survivors. So people do survive breast cancer, and people that we know, right? Not just someone that you don't know, people that we know. So many women have survived breast cancer. So let us be proactive. That is the main takeaway from today's episode, ladies. Let us be proactive about our health and continue to lift each other up. Right? We have to lift each other up and support each other. I am here to support you. This is why I'm going and I'm giving you the information, because I want you to be aware. Awareness is important. Action is what saves lives. So you have to do something. You have to act. You have to do your breast exam. That is an action. That is doing something. That is touching on your breast. Every once in a month, you're touching on your breast, doing a mammogram. That is an action as well. Your self breast exam, I can't stress it enough. That is an action. So let's be proactive about our health, and we continue to lift each other up. I just want to thank everyone for joining me. And I just want to, just encourage you. Please, please, ladies, I cannot encourage you enough to get to do your self breast exam once a month. And if you are at the age where if you're 40 and older, please get your mammogram. Or if you have your maternal, or the BRCA gene that we've talked about before on different episodes, if you have the gene, then you want to be getting your mammograms much earlier than before you turn 40. So, like we always say, ladies, on this Totally Woman podcast, I am here to motivate, I am here to inspire, and I'm here to uplift all of you. I want to thank you so much for joining me on this episode. And today, ladies, if you know someone who is dealing with breast cancer, suffering from breast cancer, someone who you have known that has passed away from breast cancer before, just please offer your support, offer your words of encouragement to these ladies. It truly, truly means a lot. Thank you again for joining me. Can't wait for you to join me on the next episode. Totally Women podcast is hosted by Rosemarie Crosdale and powered by Indie Creative Podcasts.